Hello. According to the leader, individuals living with a learning disability may have poorer physical and mental health than the rest of the population. In 2006, the Disability Rights Commission recommended the introduction of annual health checks for people with intellectual disabilities in England and Wales. They are also included in the NHS long-term plan. Annual health checks are designed to promote health and well-being, to identify physical and mental health issues early, to organise any necessary investigations and referrals, to monitor ongoing conditions such as epilepsy, asthma or diabetes, to ensure regular medication reviews are taking place, to support and signpost to relevant NHS screening, and to develop and build upon trust and continuity of care. Annual health checks are for individuals aged 14 and over who are registered with a GP practice and are on the Learning Disability Register. Healthcare professionals performing annual health checks must ensure they have undertaken the relevant training. They must use a recognised health check template that has been agreed with their local commissioning organisation. Regular searches must be undertaken to ensure the Practice Learning Disability Register is up to date. The leader annual reviews investigate the deaths of people with a learning disability. They show that people living with learning disabilities die on average 20 years younger than the rest of the population. The most common causes of death were pneumonia, aspiration pneumonia and epilepsy. It has also been shown that people with a learning disability are 3 times more likely to die from avoidable causes, such as constipation, than the general population. Evidence has shown that annual health checks help with early identification and intervention of physical and mental health conditions. The annual health check is an opportunity to provide person-centred care. It should include a review of both a person's physical and mental health. This should be a collaborative process with the individual and the carer where applicable. The health check should include a review of the pre-appointment checklist, which should be sent out prior to the appointment, a full systems inquiry as per the health check template, a review of any problems with communication, behaviour or mental health, a physical examination, taking relevant blood tests and urinalysis as needed, a review of participation in age-related screening programmes, appropriate health promotion including vaccinations review, the arrangement of secondary care and follow-up if needed, particularly if the person also has a congenital condition causing their learning disability, a review of social support arrangements and signposting to any further support if needed. It is important to discuss how healthcare professionals can support the person in making decisions about their health and well-being. Consider the best format to relay this information, taking into account an individual's level of understanding and communication skills. Annual health checks should be a priority for commissioners and providers to provide standardised, effective health checks. Ensure each practice has a learning disabilities champion to deal with booking in, checks and answering queries. Make sure you always address the person and use appropriate communication aids throughout the consultation. Consider reasonable adjustments, such as time and duration of the appointment and the waiting environment. At the end of the consultation, it is important that the person and carer have a copy of the Health Action Plan. This should be in a format that is easy for the patient to understand. Please visit the Royal College of General Practitioners website for a step-by-step toolkit providing additional resources on how to perform annual health checks.